Hi guys, I'm Tony the vet, and today I will be talking to you about what your pet might experience when they make a stay at the hospital. If you're unfortunate enough to have to take your pet to the hospital, there's a couple of little things you might have to know to keep them nice and happy before they get there, and also to liaise with your vet and tell them some of the things that your pet might be scared of or not enjoy experiencing. So when you do present your pet to the vet hospital, one of the things that they might ask you is, are they sensitive to any drugs, or is there anything that they need to be aware of in terms of allergies? So if there's anything that you know that your pet is particularly vulnerable to, it might be food, might be medicine that they've had a bad reaction to before, it's worth mentioning it to the vet when you get to the hospital. Some of the reasons you might end up at a veterinary hospital: there's all the routine procedures like neutering, sickness, diarrhea, those kind of things. But if your pet becomes acutely unwell and they need to visit the ICU or they need to be hospitalized, things might happen fairly quickly, and you're probably going to have quite a few questions by the time your pet gets there that your vet is probably going to be able to answer. But sometimes all the answers aren't abundantly clear at the start, and investigations will have to be done. If they do have to do any tests on your pet, it's probably going to involve an extended stay in the hospital just to get all the answers. Now, depending on whether you've got a dog or a cat or whatever your pet may be, sometimes they'll let some of these procedures be done consciously. Other times they might need a little bit of sedation to be able to do some of the tests. Blood sampling is a prime example. Some animals will let you take blood from them consciously so you can run it in the blood analysis machine. Other pets probably not going to let you do that, so sometimes a little sedation might be needed to give them the chance to get the blood, because they often have to shave the fur and be able to see the vein. They have to stop the animal from moving. So if your pet is a little bit fractious or nervous, sometimes they'll have to use a little bit of sedation to get the blood sample. The bloods themselves will give a lot of information. The turnaround for the blood sample depends on the equipment that the hospital has, but usually you can get the results within 24 hours. Some of the parameters that they'll be looking to check will be particular to the different organ systems. So you'll have your liver, your kidneys, pancreas, those kind of things can be checked pretty easily. The white blood cells, the red blood cells can also be checked, and the vets will have a much better idea how fit or unfit your pet is after they've seen the blood sample. They'll often do a physical exam just to make sure everything is okay. There's obviously some things that they can pick up on a physical exam, like extreme dehydration and things like that. So your pet may be put on a drip. The drip is basically IV access, which is going to allow the fluids to be put into your cat or dog, depending how sick or diseased they are. Oftentimes, if they haven't been eating or drinking, this is often necessary. If the fluids are needed, it's often put at a double the maintenance dose, just so they can be rehydrated quickly. And then once your pet is stabilized, they'll just be keeping the IV in place, just so they have IV access if any drugs are needed to be given. If the drugs are needed to be given IV, that'll have to be done in the hospital setting, so your pet might have to stay in a little bit longer than anticipated. That often can roll into a couple of days or longer, depending how sick they are and what the diagnosis is. But usually, once all the medicine has been administered and your pet's able to eat and move around freely and isn't in any pain, the vets will decide then at that stage that they might be able to discharge your pet back home to you with the medication to continue. Usually this can't be done if your pet isn't eating, but if your pet is eating, they'll be able to give you the oral medication that you can administer at home, and that will make life a lot easier for everyone, and hopefully your pet will be less stressed when they get back to your home. One of the things you have to watch out for after the stay in hospital is that there isn't any signs of any distress or discomfort when they come out, so you might have to go back for a repeat visit within a couple of days of leaving the hospital, just so the vets can recheck everything and make sure everything's okay. There may often also be a chance to retake blood samples or repeat scans, ultrasound, MRI, those kind of things as needed. But usually once the pet has been discharged, it's often a case that they'll recover quite well because they've had the intensive care they need. But you might have to do a little bit of maintenance at home. So if that does happen, that's something that they'll have instructions, and they'll usually print them onto the medicine so you can read them at your leisure, and you can follow the rules that they've set in place for you to give the medicine safely. So that's something that you might have to do. If it does happen, it can be quite stressful, but the vets are always going to explain things to you, and you can usually phone the hospital for updates and ask them how your pet is getting on, which is often going to put your mind at ease, which is a nice thing. But they are going to be in the hospital, and like ourselves, it's probably not where anyone really wants to be. but sometimes it's necessary and it's something that you should consider if your pet is quite ill. That's it from me, from Tony the Vet. I'll see you guys soon.